This podcast does not provide medical advice. Please listen to the complete disclosure at the end of the recording.
Hello, everyone, and welcome to Everyone Dies, the podcast. I'm Marianne Matzo, and Charlie's in New York. I think you guys have known, if you've been kind of following along every week, that I've been pretty sick and in and out of the hospital with some surgery, but I hope I'm on the mend, and desperate times call for desperate measures. So in order to get the podcast out this week in sort of a timely manner, I'm going to be recording it alone, but I'm going to pretend that Charlie's with me because he laughs at my jokes, and maybe you guys laugh at my jokes, but I don't know about it. So grab your adult beverage or grab a whole bottle of something, get tea, coffee, dessert, relax, and thank you for spending some time with me this week. We're going to try to get our rhythm back with our Detroit-based team of Charles Navarrete and myself, but this week you'll need to settle for me. In the first half, I'm going to talk with you about a recipe that I recently just discovered or rediscovered. In the second half, we're going to talk about caregiver grief, caregiver burnout, being a caregiver. And in the third half, we're going to just take a moment and be happy that we're all together and I'm able to chat with you, and you're able to listen and learn. So the recipe that I wanted to share with you is something called city chicken. And David, my husband's from Texas, and when I mentioned that to him, he said, "What the heck is that?" And so I thought, well, there's no chicken in city chicken. I mean, it's just something I grew up eating. So I went and, of course, had to do some history. And I guess it goes back to like pre-Depression days when chicken was more expensive than veal or pork, imagine. And so my mom used to make it. Used to be like a Sunday dinner that we just loved. But I guess for other people in that area, Pittsburgh, Michigan, that area of the country, for some people it was like a regular evening meal. It wasn't that way in our house. But so city chicken is pieces of pork and veal, kind of like bite-sized pieces, put on a stick, and I don't know how to describe it. Put in breadcrumbs, breaded, fried, baked. My mom always made it with gravy and mashed potatoes, and it was wonderful. And I came across just this week a picture of city chicken. I thought to myself, well, whatever happened to city chicken? Well, I guess that's just something my mother made and that I have not picked up. So I'm including a recipe for city chicken, and I am one of these days going to actually make it again and see if it's as good as Mom's. So please go to everyonedies.org. That's EVERY, the number 1dies.org. Send us your recipe to share with others. We appreciate your questions, your jokes, anything else you want to tell us. You can email us at everyonedies.org. Again, EVERY, the number 1dies.org. You can join us on Facebook. Rate and review our podcast. Molly, our our Twitter wrench, is hoping that you contribute to her happiness by following us on Twitter and reposting her tweets. She'd be just so happy if you guys did that, I swear. So what I thought I would chat with you about is caregiving. And I had a lot of experience with that lately because poor David. Oops, I just dropped my pencil. Just a second. See, Sandy's going to get mad at me for making that noise. Squeaking my chair and moving my papers. So I'm just letting you know that in advance. Had a lot of experience the last few weeks. I had my surgery on January 11th, and we are now at the end of February, and I'm still recovering. Spent last weekend in the hospital, in the emergency room, and then in the hospital. So poor David has been learning how to be a nurse, packing my wounds that have come apart, putting my shoes on for me because I can't bend over because I have a huge abdominal wound. And so I'm watching, what he goes through. And I've been a caregiver when my mom was in hospice, and I'm certainly well aware of being a caregiver because I've been a nurse for over 40-some years. But it's kind of interesting from, I guess, my perspective now is to look and see the stress that family members go through. I think at every point of our lives, it's kind of good to look at what's going on from the perspective of the age that we are at that moment. I've always thought that people should go back and watch films from, that they saw when they were 18 or whatever, because the films are so much different when you're 60-something than when you're 18, because you see different things, you feel different things when you watch. And I think that that's been my experience with caregiving, is watching David be a caregiver. And so I wanted to talk a little bit about that. So the role, and my throat is still funky from the surgery. Don't ask me why, because I don't know, but we're working on it. So when you're looking at being a caregiver, you're really looking at issues of cumulative loss. Death anxiety. We look at people and say, oh my God, are they going to die? Is this going to be, something that's going to end their life and I will, be left alone? And then there's the issue of being aware of your own possible death. You look at somebody who's really sick and you say, God, am I really up next? Is this going to be like what I'm going to go through at the end of my life? So one of the first things I wanted to chat with you about is this whole idea of cumulative loss. And cumulative loss is a succession of losses that's always been considered common to nurses. When you're a nurse and you're taking care of people, especially like when you're working in hospice and in palliative care, you're dealing with death constantly. And I don't mean constantly in a overblown kind of idea. I mean truly constantly. You might sometimes have 2 people die in a day. For anybody, that's a lot. But now, with COVID and with our numbers of 500,000 deaths, it's not uncommon to hear about people saying, well, yeah, I'm taking care of my husband with Alzheimer's. My mom just died from COVID. My father's in the hospital on a ventilator. When you're talking cumulative loss within your own family, within your own support system, where in the world would we ever learn how to cope with that? And the reality is that we don't. We don't go through, normal human beings as opposed to super nurses. And I say that tongue in cheek. Nurses learn how to adjust to that. And some people never do, and they aren't able to stay in and continue to do that work. But, you're people who are taking care of family members, and because of the pandemic, are having to face death in lots of different areas. And you might not have time to resolve a loss before another one occurs. You read about or you hear about people, my mother-in-law was going to take care of the kids, and then she got sick and she died, and then this happened, and then this happened. It's like, good Lord, it's the trial of Job. There's just too much going on. So cumulative loss is a succession of losses experienced by people who work with people who have life-threatening illnesses and their family, typically on a daily basis. We can experience anticipatory and normal grief before and after the death. So if we're taking care of a parent with Alzheimer's, we know that there is no cure for that disease. It's not a maybe. We know. And so we anticipate and start to grieve their death long before the death actually occurs, because it's a long death. You know, that loss of who that person is starts long before they actually do die. And so there's that anticipatory grief. And then there's the grief that comes when they actually do die. And then again, like I said, in the age of the pandemic, there's all the other grief and other losses within your church and your community and your family that is also going on. Not only is loss painful, but when we're exposed to death frequently, we might not have time to resolve the grief issues of one patient before another person dies. So, you know, as an example, our mother may die, and we think, oh, you know, I need to grieve her. I need to clean out her house and get her house for sale, all the things that we might need to do. And you say to yourself, I don't have the energy to do any of that. I feel like I just need to sit in this chair. And probably that is exactly what you need to do. But if you're caring for somebody with another chronic disease who needs you to be up and cooking and bathing and changing them and doing all the other things, you don't have the time to go sit in that chair and just say, this really sucks and I'm really sad. Cumulative loss can help us kind of explore our feelings about loss and about grief. Some people talk about using poetry. Some people talk about other kind of, journaling, things like that. And that works great for some people. For other people, it's like, good Lord, I don't have time to go to the bathroom. When in the world am I supposed to do journaling or things like that? One of the poems that I used to use when I was teaching this content to nurses was a poem that Sandra Bertman had published in 1999, and it's an anonymous poem written by a nurse who's recalling her experiences in Vietnam. And it's called Hello, David. So here's the poem. Hello, David. My name is Dusty. I'm your night nurse. I will stay with you. I will check your vitals every 15 minutes. I will document, inevitably. I'll hang more blood and give you something for your pain. I'll stay with you and I will touch your face. Yes, of course, I'll write your mother and tell her that you are brave. I'll write your mother and tell her how much you loved her. I'll write your mother and tell her to give your bratty kid sister a big kiss and a hug. What I will not tell her is that you were wasted. I'll stay with you. I'll hold your hand. I will stay with you and watch your life flow through my fingers into my soul. I will stay with you until you stay with me. Goodbye, David. My name is Dusty. I'm the last person that you'll see. I'm the last person that you will touch. I'm the last person who will love you. So long, David. My name is Dusty. David, who will give me something for my pain? And, this was written during probably a first job as a nurse in Vietnam. And how did that nurse figure out, you talk about cumulative losses. I mean, that's, in any kind of engagement is probably, death after death after death after death. There's no minute to even think about what is really going on here. So caring for the dying may elicit significant distress for healthcare providers. It causes significant distress for lay people who are taking care of family members, because your work as family members, it is unforgiving. It is without a break. It is your mom, your dad, your husband, your wife, your child. Not only are they patients who need care, but they're people that you love. Feelings of failure can result in both wishing that the patient would die to avoid having to deal with the patient. And, we can pretend that that's not a true feeling, but you and I both know we're pretending. Because there are those times when we're taking care of somebody that we say, oh my good God, enough already. But that's not how it works, and we have to figure out ways to pick ourselves up and continue to move on. We have to think about overtreatment. Sometimes we feel really guilty because we think to ourselves, I just really don't want to do this anymore. And so we kind of err on the side of overtreatment to ensure that everything has been done to save the patient, so that we as survivors can say, hey, I did everything I could for her. They didn't survive, but I did everything and it's for our guilt. It's for our feeling of, I don't want to ever have to look back and say, oh my God, I could have done this and I didn't do it because I really didn't want to have to continue to take care of them. So that's a reality. The closeness and the empathy that we have with people can also give us sort of difficult responses in terms of facing people, facing the situation. Let me put it this way: to face the situation, to confront our own mortality. When we're looking at mom, in the end stages of Alzheimer's or Huntington's or any of these chronic diseases that don't have a cure, you're looking and you're saying, oh my God, what if this is me? What if this is what my end is going to be? And thinking about, well, what is it that you want for you in terms of the end of your own life, in terms of your own mortality? Grief about the loss of value in meaningful relationships with people is a part of the caregiver's experience that we say, yep, we acknowledge that. We know that this is a meaningful relationship, but we don't necessarily really understand what does that mean and how does that play out, and how does that play out over a long period of time. Now, according to Dan Sulmazy, healthcare is about being there with people in their finitude and their doubt, meaning to be with people when they're not sure about what's going to happen and when they're facing the very end of their life, that we're there in their pain and in their uncertainty. And we're respecting each one and saying that we care and that our actions show that we care, that we will take care of people no matter what comes and whatever faces us. Now, in the past, healthcare professionals were often told to control their emotions and to emotionally distance themselves from patients and family. But as a caregiver, you can't do that. How do you emotionally distance yourself from your own mother or your own father or your own husband? They're your family. And so it's really hard in terms of how do you express your feelings and your emotions, to process the grief and the loss, and to provide quality care for people who are living with these incurable diseases. And I've seen and I've had conversations with people who say, I just can't do it anymore. And I'm not exactly sure where this mandate has come from that says, no matter what happens with your parents, suck it up, buttercup, and take care of them. Because that can be a totally untenable situation. We can't always do that. We are giving our life, our sanity, our physical health to that situation. It's not going to improve their health. They're not going to remember it. if anything, we're doing it for ourselves or for other people, so other people can say, "Oh my gosh, look what she does for him. Look what he does for her." And I think that sometimes we need to kind of take a hard look inside and say, what is the purpose of this? Why am I doing this? Why am I getting up 3 times a night because they're incontinent? Why am I worried that they're going to run out the door and get lost? I can't keep them safe. And take a really hard look. Our role, if I'm a woman, so I'm just going to go from the daughter point of view. Our role is to be their daughter. There's no book I've ever read that says you're their daughter and you're their caregiver. That's why we have long-term care facilities. That's why we have memory care units. And in all of my years of working with this population, the caregiver feels better when their loved one, their mother, or their parent is in a safe environment. And the elder, even though they're not really quite sure, they feel safer too. They know that, this is a safe environment. I'll be okay. And nobody's going to lose their temper with them. And when you come to visit them, it's going to be a nice visit. It's not going to be about, "Oh my God, you wet yourself again. Oh my God, please just change your shirt. Oh my God, come on, you need to take a shower." Those don't have to be parts of our relationships with our parents in old age. There's other people that can do that, and we can do what nobody else can do, and that is to love them. So take a look at how we view death. You look at past experiences with death and on a personal, professional level, and maybe there's unresolved grief issues that can influence our ability to cope with caring for our family members. Think about your past experiences with other people who've died. Sometimes people will look at, a grandparent and they say, "Oh my God, Grandma died this way, and I don't want that to happen to me." Well, let's remember that maybe Grandma died. I was in 8th grade when my last grandparent died. So if I'm going to go back to what was going on in healthcare in 1970, I don't think we're there. I think we've moved a little bit forward, and I'm being facetious. We moved a lot forward. So I can't go by how Grandma was taken care of because it's not the same system. And so put that into your decision making. You're talking about, rotary dial phones versus your own cell phone. Our life changes, our support systems change. When I was a kid and Grandma was, at the end of her life. I hope I dropped my pencil again. Sandy, I'm sorry. When I was in 8th grade, and Grandma was at the end of her life, she had pancreatic cancer. She had all 4 of her kids there, all of their spouses, any of the grandkids who were, old enough to help, which was, there was a bunch older than me and a bunch younger than me. So there were, a bunch that were older that could help out. She had a huge system of people who could help. Nowadays, like if we look at me, I have 2 daughters in their 20s who, are in college and starting out. It's not the same situation. I can't expect the same from them as a cadre like my grandmother had of, adults, like actual adult people with their own kids and, in their 40s. So situations change, and don't go gut reaction on, well, this is how it was when I was a kid. Yeah, a lot of things were different when we were kids. They still made city chicken back then. But, things change and we have to adapt. So in caring for the dying and bereaved people, we're subject to experiences that will demand a grief response of our own. Whenever we're investing ourselves emotionally, we have a need for a grief response. That's from Rando. Deb Sherman says, she talks about this concept of reciprocal suffering. You know how a reciprocal saw goes back and forth, back and forth. Well, suffering can go that way too. It moves. It can go back and forth between patients and caregivers and move us toward the actualization of our human potential with a vision of imagined possibilities and renewed commitment to the care of ourselves and to others. So, learning to appreciate the awards of caring, learning to care for the dying has been likened to learning to love. The central concept is that the more we give of ourselves, the more we receive. Remember that moments of love and caring with your family. And may the memory of those moments reinforce your commitment to care and bring forth a sense of hopefulness and transcendence. If you go to our website, everyonedies.org, that's with the number 1, we have some resources there for you.
And with that, thank you everyone for listening. Please stay tuned to future episodes of Everyone Dies. Our thanks to our executive producer, Major General Retired David Gillette, our producer, Sandy, John, our technical advisor, Tom Hartman, our administrative advisor, Molly, our Twitter correspondent, and our friends, family, and our loyal listeners who are supporting our work at Everyone Dies. This is Charlie Navarrete.
Charlie, we need you back. I'm Marianne Matzo, and we look forward to talking with you soon. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.